All right, today we're going to talk about why exercise selection in season matters. I'm going to show you my favorite exercises, the exercises I would avoid, and if you stick around to the end, I'm going to show you how we implement them into our programs and how you can plug them into your own program. Okay, so before we get going, I think it's important to understand some basic anatomy. The muscles along the inside of the thigh are collectively known as the groin. This is a group of muscles known anatomically as the adductors, and they make up the groin complex. You'll hear me talk about adductors and groin interchangeably within this video. Just know that they mean the same thing. It's also important that we understand how we classify injuries. So, in general, injuries can fall into two buckets: macro trauma and micro trauma. Macro trauma is what you think of when you think of a serious injury. So think of slamming into the boards and separating your shoulder. That is one singular event that led to a serious injury. We call that a macro trauma. Micro trauma is a series of smaller injuries that can eventually lead to a macro trauma or can be a nagging injury on their own. So think of small pulls in your groin that eventually can lead to a massive groin pull or just a nagging hip pain that persists throughout the season. So now that we understand how we classify injuries and we got a basic understanding of anatomy, let's understand very briefly muscle contractions. There are three types of muscle contractions, being isometric, eccentric, and concentric. Isometric is a muscle contraction that produces no change in a joint angle. So you're producing force via the muscle, but you're not changing the angle of the joint, or you're not producing motion of the limb. So you can think of something like a wall sit as being an isometric. The muscles are contracting, but the joints are not moving. Eccentric is when the muscle is contracting, but the joint angle or the muscle is lengthening. Okay, so think of the descent on a squat as an eccentric quad contraction. And then concentric is a muscle contraction that causes a shortening of the muscle and generally a change in the joint angle into a smaller position. So think of a bicep curl as a concentric action. So eccentric and concentric contractions are opposing but complementary actions. So as one side of a joint concentrically contracts, at some point, the opposite side of the joint is going to eccentrically contract. So let's take the skating stride, for example. As you push away in one propulsion of a skating stride, the lateral hip and glute muscles are going to be contracting concentrically to produce extension of your hip. At a certain point during that extension, the inside muscles, the adductor or groin complex, is going to eccentrically contract to slow that extension down and eventually concentrically contract to pull your foot back underneath of you. Now in hockey, because the stride happens at this backwards and oblique angle, the adductors now act more like a hamstring in a sprinter. Because you're pushing at that oblique angle to cause hip extension, your adductors are now eccentrically contracting at very high rates of speed to slow that leg down when you get to end range and pull it back underneath you. So because this is happening at a very high speed, you can have one single event like a macro trauma like we talked about earlier, which is going to cause a tear in this muscle group. And one of the most common ways that this would happen would be when you overstride. So the muscles lengthen to a degree where they're not used to at a very high rate of speed, which ends up tearing the muscle, leading to that macro trauma. But the more common scenario in hockey is because the stride is such an awkward angle, it happens at that extension oblique angle, it's really hard on the hips. You essentially get a lot of micro traumas that lead to what we call overuse injuries. So the muscle just gets overworked throughout the season because you're producing so many strides, because you're playing so much and practicing so much, that the hips just aren't really used to that demand, and you get what's called an overuse injury. And in general, an overuse injury will happen because the musculature involved wasn't prepared for the demands of the sport. So either you didn't do a good enough job in the off season of preparing for the amount of work that the adductors are going to see, or you're doubling up on it in season and you're causing this massive overuse of a muscle group, which leads to that overuse injury. And so you can generally combat overuse injuries by training these things in the gym or training to avoid certain positions. And this is exactly how this concept fits into the weight room and why how you structure your in-season training and the exercises you choose to do matter so much. Because at an elite level, there's so much hockey being played between practices and games, you're getting a lot of eccentric load on the groin because of the amount of strides that are being put into the ice each week. And so intuitively, because this is such an injury-prone area in hockey players, when you get in the gym, you naturally want to train this to kind of combat the amount of work that it's seeing on the ice and hopefully reduce your risk of injury. However, the devil is in the details here. And so if we go into the gym and we're adding a bunch of eccentric load by doing a bunch of eccentric dominant exercises, we're adding to our problem by adding more eccentric components to that groin musculature. So some of the most common groin exercises you'll see are these top foot elevated type exercises where you're really using the groin muscles to control that lateral shift in the upper body. Now, these are great exercises, but we tend to use them more in the off season to prepare the tissues for the demands of the sport because they're more eccentric dominant. And so in season, we absolutely want to be training the groin, but we want to try to stay away from eccentric contractions as much as we can. In season, instead, we opt more for concentric or isometric type contractions. So some of my favorite isometric exercises that we opt for in season are these squeezing type exercises where you're in this side plank position or you're in this bridge position and you're really using the groin to squeeze that med ball and you're not moving at all. And we also use exercises like this one where you're actively using the adductor muscle group to bring that foot back to midline. And this is mainly a concentric dominant exercise, or at least the loading portion of the exercise is concentric dominant. So overall, these can be much better options in season for exercise selection because they still allow you to take care of an injury-prone area in the groin while also not potentially being the cause of that injury. So some of the ways that we add these into our programs are as standalone exercises, or what we call corrective series, which are basically just a series of exercises at the end of our workout that are aimed at targeting injury-prone areas for hockey players. And again, we just place those at the end of our workout. We also sometimes pair these with our main lifts. And so you'll sometimes see something like a rear foot elevated split squat paired with that lateral lunge plate drag that you've seen earlier. And then a lot of the time we place these as corrective series on their standalone recovery days. So our recovery days in season are focused on driving some mobility into those hips and then doing a couple corrective series to take care of those injury prone sites. And so this really is how details and exercise selection matters in season and can be the difference between whether you stay on the ice and stay healthy all season or whether you end up on the trainer's table a couple times a year. If you want a program with these details in mind that's done for you and it's full of elite hockey players like yourself, you can hit the link down in the description and you can grab yourself a month to our training membership. You can also get 15% off using the code MEMBER15 at checkout. And if you found this video at all helpful, please consider liking it, sharing it with a friend, and subscribing, as it's the only way that this channel can grow. I'll catch you guys on the next one.